In this video, I'm going to show you the best example of how drugs treat symptoms and not the cause of disease. So the last video I posted was about how gut dysbiosis increases the severity of COVID-19. And I briefly showed this chart, and you can see the term endotoxin is there. So it's endotoxin that is the big issue when you have gut dysbiosis. So what is endotoxin? Well, you can see it is right here. This is the outer membrane of what are called gram-negative bacteria. And whenever these bacteria, so when we overeat these calories here, now the average American, of course, you should never forget that the average American gets about 60, I mean, it's shocking, almost 60% of their calories from this crap. It's unbelievable. So there's a host of problems that occur when we overeat these calories anyway. So once we eat these calories, they're absorbed, and this increases blood glucose. So blood glucose levels go up. These calories will also lead to increased amounts of omega-6 fatty acids in circulation, and a host of other things too, but these are two big inflammatory drivers that come directly from these calories. Now in the gut, when we expose gut bacteria to these calories, the gram-negative bacteria, what they do is they release their endotoxin. So endotoxin is released, it gets absorbed, and now you have increased endotoxin in circulation along with the increased glucose and omega-6 fatty acids. I mean, what a nightmare. So these are just three of the multiple ways that eating like this can flame one up. So if we just focus on endotoxin, because what I did is I hunted around when I was writing this book, I hunted around and I found multiple articles that talked about these very common conditions that are associated with increased levels of circulating endotoxin as part of the drive to all of these conditions. So when you look at up at the top, so you see anxiety. Now this is anxiety disorders, which actually includes depression. So you can see the medications that are used to treat anxiety and depression. Now these medications have nothing to do with endotoxin. They just go after the pathways of depression and anxiety. So what about widespread pain or fibromyalgia? Well, 5 million Americans, medications have nothing to do with endotoxin. Chronic fatigue syndrome, almost 1 million medications, nothing to do with endotoxin, nothing to do with the cause. These medications, nothing to do with endotoxin, even though the problem is the gut itself. You can see up to 20% of the adult population in the U.S. has IBS, irritable bowel syndrome. Almost 20% of the adult population, and this affects females more than males, have migraine headaches. These medications don't do anything for that. I mean, it's nothing. So we can just go on down the list, multiple medications used to treat interstitial cystitis. This feels like a bladder infection, but there is no actual infectious agent. Look at the medications. Nothing to do with endotoxin. So you can see none of these medications get at the cause, which is, in this case, endotoxin. Type 2 diabetes is promoted by endotoxin because all these conditions are inflammatory. So anything that jacks up the flame is going to increase the expression of these various conditions and symptoms. And they've identified people with these symptoms have elevated levels of circulating endotoxin. Now that does mean that we all do have endotoxin in circulation, but it's not supposed to be excessive. And it becomes excessive when we overeat the calories that you see in the bottom right-hand corner, the bottom side, bottom third of the D-flame cover. So multiple medications for going after blood sugar regulation, but that misses the cause, which is a chronic inflammatory state in part caused by endotoxin. Heart disease, I mean, huge killer in America. Most common medication, in part driven by endotoxin. Now the endotoxin not only comes from your gut, it also comes from the mouth. And if you talk to any dentist, and I've done a lot of conventions for dentists, and they all just deal with the fact that the average person tends not to floss, they got gingivitis and or is periodontitis, and that is associated with increased circulating endotoxin. Hypertension. I mean, after age 55, the average person will eventually become hypertensive to some degree. And that's somewhat normal. It's a little bit different in that case. At the end, if it's just minor. But multiple people in their 30s and 40s have hypertension, in part driven by endotoxin. These medications, no effect on endotoxin. And just feeling like crap in general. Millions of people. and they may be prescribed various medications or none at all, and they just suffer along, and they have no idea that it's because overeating sugar, flour, and refined oils jacks up endotoxin, which drives the inflammatory state that helps to drive all of these conditions for which these medications that have nothing to do with the cause are prescribed, and the average person stays on them for very, very, very long periods of time. So the easiest way to free yourself from medications that are used to treat symptoms caused by excess endotoxin in part would be to reduce your consumption of these refined oil calories to the point where your inflammatory markers that I've outlined in previous videos and outlined in detail in this book are normalized. And that does not mean you can never have cupcakes, white bread, or French fries again. It just means that you eat them at a level so you do not exceed your inflammation threshold. It's that simple. It need not be any more complicated than that. And you can see why this is not promoted clearly, or nutrition is confusing, because how many billions or trillions of dollars are made on these medications? So drug companies rely on people eating like this, because if you didn't eat like this and you stayed active, these medications would be minimally used. So you know it's not in the best interest for drug companies to have the population healthy. But you can do it. And there are many ways. My approach, of course, is the Deflame approach. All these books are available for single copies on Amazon, multiple copies at deflame.com. And I don't know, people say if you've got to hit the thing and ring the bell. I don't know if that's true or not. I haven't been able to tell by myself. But you can see up here in the top right all the social media sites to if you like this kind of information. So you can go right to Twitter. You're already on YouTube. You can like there, and you can go over to the Deflame Facebook page and like it if you have an interest.